For those of you who don't know me, my name is Todd Ebert. I'm the president and CEO of the Healthcare Supply Chain Association in Washington, D.C., and also on the Bellwether Board of Directors. And just so that you know, full disclosure, I am a lobbyist. How do you like that? And I just completed my monthly report today, so we do it right.
We still love Todd.
And they still do in Washington as well. Anyway, I am delighted to be up here tonight to introduce to you Marvin Feldman. And I'm going to say Marvin Feldman, registered pharmacist, into the Bellwether League class of 2018. Why I made sure that I said registered pharmacist is because, you know what? I'm a pharmacist too. And I am delighted to be able to recognize him today in this particular situation. Let me give you a little background relative to Mr. Feldman. He has a career span of 48 years. Now, I met him for the first time tonight. And I said, Marvin, you're not that old. But he's had a great career, and let me outline some of that for you in just a second. 25 years in healthcare consulting and 16 years in pharmacy practice management. He's had a significant career in pharmacy, which includes pharmacy and supply chain leadership, which is very important. His work experience has included Brigham and Women's Hospital in Boston, St. Elizabeth's Medical Center in Boston, the VA Health System in New England, Concepts in Healthcare, and Premier. That GPO thing, that's another thing that we have that connection, two pharmacists from a GPO. As a board member of the Bellwether League, when I have the opportunity to review the submissions for recognition, and there are many impressive submissions, as you'll see this evening, for Mr. Feldman, there were a number of key attributes that jumped out at me that I think are important, and I was pleased to see other board members recognize them as well. So I want to identify a couple of the key issues that I thought really had Marvin stand out. Number one, and this comes directly from the comments that were made in the submission for his application as a Bellwether. His initial work started with the design of models that redeployed existing staff resources at Brigham and Women's Hospitals and later at St. Elizabeth's Medical Center to ensure all staff were appropriately assigned work that enabled them to practice at the top of their license. By creating a stepwise approach to question the value added from each task they perform, greater efficiency resulted, which enabled significant redeployment. To me, as a professional, a licensed professional, that's a big deal to be able to practice at the top of your license. That is very important. And as a former director of pharmacy earlier in my career, that's precisely what we did, is to enable the pharmacists to practice at the top of their license. I thought that was a big deal, and at the same time, it was extremely rewarding to the pharmacists that worked in the organization, and I'm sure to the pharmacists that work for you. Something else that I thought was very valuable as well, and this is something that has been recognized in healthcare, I think, for quite some time. He's taken his skills to Premier, the group purchasing organization. As the value propositions of group purchasing organizations were evolving, his skills were precisely what was needed. Not just for the price of a widget or a product, but also the appropriate usage and management of product in quality patient care. Quality care, that's extremely important. We all know that improving quality reduces cost, which is another big deal in healthcare. And finally, and this is another thing that rings true to me, I'm always interested in the person's ethics, moral standards, and integrity. An example that was provided was about, as a hospital pharmacy leader, how one had to deal with substance abuse. With investigative work, police and legal action, and in some instances, the removal of a professional license. Having worked on these issues before as a director of pharmacy, they were hard, they were challenging, and they weren't fun. But The approach that you had was with an attitude of doing the right thing, which Marvin did, which I think is extremely important. Ethics, moral standards, and integrity are extremely important in this profession. So based upon a few of the issues that I've identified and outlined, and many others about Marvin Feldman, I am pleased to present to you Mr. Marvin Feldman as a bellwether for the class of 2018. Mr. Feldman.
Thanks, Todd. I just want to thank the Bellwether League for this wonderful recognition. Also want to recognize a few people that helped me through my career. Certainly my wife, Gail, who's here tonight, all her love, her support over the years of not being home, being on the road, or being in the hospital, which was a lot of long days and nights. My kids, Matt and Hillary. My daughter-in-law, Amanda, is home with our little grandson, but waiting for the second one to come in 2 months. I also want to recognize another individual that can't be here tonight for health reasons, Tom Hughes. I know a lot of you know Tom. I joined Tom in his consulting practice a number of years ago, and he asked me to join his practice because he saw that being a pharmacist, there was a lot of things that we could do together to work together as supply chain and pharmacy. He saw the intertwining of both of those professions. This evening, when we sat in the forum that you conducted this afternoon, I have to tell you, I look back at the last 40 years of my career. Having now retired, it's easier to look backwards than it is to look forward. I hope that I had able to accomplish some of the objectives I set out, but most importantly, I guess anecdotally I can report to you, I heard a lot of discussion about what will it take, how long will it take for supply chain professionals to be able to participate in the true product decision process and influencing healthcare for cost-effective benefit. Well, I can tell you, when I started in my practice as a pharmacist 40 years ago, I can think back to the first day I spent at Brigham and Women's Hospital being completely read down by a senior member of our medical staff, a Harvard faculty physician, who told me I was only a pharmacist. I had absolutely no business being on the floors, no business asking or helping to give any thoughts at all about how to take care of that patient, and I should get the hell out of Dodge, get out of here. Now, 40 years later, I dare say physicians hit the floors asking, where are the pharmacists? If they're not there, they panic. The input, the provision of support and guaranteed information is phenomenal. There's huge changes that have occurred in that profession, and the same will happen with supply chain, but just to think that took 40 years. Certainly those changes started a few years ago, but not that many. So it takes a long time and a lot of perseverance and a lot of credibility to be gained, but it's going to happen. So stick with it. Pursue it. It will happen. And I think you'll all be leading and involved with departments and staff that are just absolutely critically part of the healthcare team. It's a wonderful feeling. It just takes a lot of work to get there, but everybody's on track and it will happen. So once again, thank you, Todd. Thank you for the kind words, and thank you all very much for the award. Thank you.